we're going to move on to information about abdominal aortic aneurysms, which are not discussed enough. And this is why there are some organizations that will cover, be there to provide support to anyone, of course, but their focus might be on aortic valve disease and the aortic aneurysm that's, typically involved, which is ascending. Then there's organizations that might only want to focus on the nature of thoracic aortic disease. This is all valid, very valid. And I love that this delineation occurs in our community. We happen to want to provide education on everything and talk to everybody and anyone. I know it's a little potentially biting off more than you can choose, but I love it. We love it here. We welcome anybody who has aortic disease in any zone. Let's get together. Let's learn about it. And here's why. Just because you have a thoracic aortic aneurysm doesn't mean with 100% certainty that you are at zero risk for developing one in your abdomen, and vice versa, okay? Maybe if all you had was a bicuspid valve, you may not ever develop an aneurysm to begin with, period, end of discussion, right? But when it comes to aneurysms of a vessel, I'm not too sure that at that line at the diaphragm, that Harry on one side and Charles on the other side of each other, hey, like, no, you can't cross. No, you can't cross. You keep your disease there. Don't come over here. I don't think it works that way. So better safe than sorry. We're going to talk about abdominal because there's such a high number of individuals, mainly men, who develop abdominal aortic aneurysms. Huge, huge in this country, huge, okay? Again, an aneurysm, a bulge, balloon-like structure that occurs in the wall of this blood vessel of the aorta, and it causes it to stretch to a larger size than its normal width. It doesn't matter where, that's what an aneurysm is, and you can get aneurysms anywhere in your body. The vessel, because it's being stretched, loses much of its natural strength and ability to accommodate the blood volumes, although there's not as much initial blood volume in the abdomen because the most blood volume is what comes out of the heart. But because it can't accommodate it, it puts you at greater risk for a rupture. That's not a good thing. So when you have a AAA or abdominal aortic aneurysm, that is a bulge that is occurring and it extends at the level of the abdomen in your aorta. Okay, so when an aneurysm forms, it can be at risk for dissection or rupture all the time. That's at risk for that. And that can be very serious and could be fatal. So here's a diagram of an abdominal aortic aneurysm. Here we go. That's where your aortic valve is. That's your root, okay, because your heart would be right here. This goes behind the heart. This is towards the back, everybody. Maybe a lot of people think it's to the side. It's to the back. And here we go. And boom, we're in the belly. We're in the belly. And there it is. That's a big aneurysm. That's a big one. When you compare it, look, if you took the straight line down here, that's big, and it's going on both sides. It's not, this is no joke right there. In most cases, there's not going to be a symptom either here, which is crazy. So you're going to find out incidentally if you have one. However, but if it becomes large enough, well, then some people feel this deep, constant pain in their belly, pulsation near the belly button, or persistent back pain. So persistent pain, you might start feeling that. So if you're someone who is at risk to developing any kind of aneurysm because your family has a history of aneurysms and you begin feeling these symptoms, definitely talk to your physician. Make sure they know about your family history, which is why we say think aorta, think family, and let them then order the appropriate tests, which is typically an ultrasound. It doesn't even have to be a CT or an MRI. It can be an ultrasound with a wand. It is so non-invasive, okay? So the most common symptom of a ruptured abdominal aortic aneurysm would be sudden and severe pain in your abdomen, okay? A ruptured aneurysm can cause massive internal bleeding and it could be fatal, but it's not necessarily going to be as instant as if you had it happen right at the level of your heart because there's higher blood volume up there. So here's some causes and risk factors for a AAA. Atherosclerosis, and that is hardening of the arteries, and that's typically because of cholesterol and fat buildup and high blood pressure and blood vessel disease or trauma. All of those are things that can cause a AAA. But the biggest known risk factor of a AAA are anybody over the age of 65 and male. Those are your two biggies. Now you start adding in those other things I mentioned, and you're just thrown in the pot for a potentially not great recipe. Just things to think about. Other risk factors would include long-term smoking, high cholesterol level. Boom, boom, put it in the pot of the recipe, add family history in there, sprinkle that in there, and you're at an increased risk of having an aneurysm. Diagnosis, because they usually don't have any symptoms, they get detected during a routine exam. The screening test is often done through an abdominal ultrasound. And in the United States, for men over 65 with higher blood pressure, it's going to be a free screening. And there's a lot of organizations, nonprofits, and companies now that are starting to do these types of screenings for free. So easy to screen for an abdominal aortic aneurysm that if you're under 65 and you have a family history or you have a known connective tissue disorder, you should be able to get screened sooner than age 65. Don't quote me on that. Don't go telling people that Karen said it. So I said should. I feel confident in my answer, but it said should. If the patient is known to have an abdominal aneurysm, then a CT scan is going to usually occur to have a better understanding of the size. Surveillance with medical management is typically appropriate when it has a diameter of less than 5.5 centimeters, which I know sounds scary to some of us that are so used to 5.5 in the thoracic being that magic number for surgery. It is different in the stomach. Again, blood volume is less. Sometimes the ones in the stomach tend to grow, I believe, slower. So the numbers, the ranges are a little bit different, okay? 5.5 centimeters for males and 5 centimeters for females. And this would involve taking medications to help lower your cholesterol and your blood pressure. And they need you to quit smoking because it directly does what? It impacts the endothelial cells. And if you can do those things, it will positively impact and slow down the growth of the aneurysm. And we are going to have a very interesting live event happening on the 12th. No, actually, it is happening. Oh, yeah, on the 12th with Dr. John Martin. He is part of University of Maryland, and he's doing a lot of work with abdominal aortic aneurysms. And so this is going to be one of the first times we're really having a physician here to focus his talk about abdominal aortic aneurysms. And he has a nonprofit called Dare to Care that does some of these screenings for free in the community. So put that one on. If you click the like and subscribe button and the bell, you'll get notified so you don't have to try to remember. All right, so if an abdominal aortic aneurysm is large, like close to 5.5 centimeters, and it's detected before it ruptures, most people will be advised, let's think about surgery. And let's replace the aneurysm with a piece of synthetic material. That would be a graft, or it could end up, not a graft, a stent, okay? A ruptured AAA means it ruptured out of that third layer. Ripped right through all three, requires immediate surgery. And if you're at high risk for a thoracic aortic aneurysm or you have a family history for one, please be sure to reach out and discuss this with your physician and find out about your potential screening options. Think aorta, think family. Do not think one area can never impact another area. Do not. Put all your chips on red. You have a better chance. Just don't do it, okay? That is your abdominal aortic aneurysm post.